Modern professional life demands constant attention. Between overflowing inboxes, late-night Slack messages, and the pressure to always be available, chronic stress has simply become the accepted background noise of our careers. This chart shows a staggering reality about how we handle that pressure. Americans left 662 million vacation days completely unused in 2016, and that number climbed to over 700 million the very next year. We tried to outwork the physical consequences of being tied to our desks. We meticulously track our daily steps, carefully balance our macronutrients, and swallow morning medications to keep our biology in check. But there is a glaring flaw in this logic. We treat taking a meaningful break as an optional luxury, while viewing strict diets and rigid gym schedules as mandatory daily disciplines. The irony is that the baseline stress of trying to perfectly execute a modern health routine without taking time to rest might actually be quietly neutralizing all of those physical benefits. If you eat well, hit the gym, and follow your doctor's orders, you might think you have your cardiovascular health completely figured out, but you're likely ignoring a critical fourth pillar of preventive medicine. To see exactly how vital this pillar is, we need to look at a shocking 40-year cardiology study, calculate the precise biological math of taking time off, and map out a realistic blueprint for a health-saving staycation. Because we have to answer an uncomfortable question: what actually happens inside the body when the chronic stress of modern life overpowers the best tools of modern medicine? In the 1970s, researchers launched the massive Helsinki Businessmen Study. Over 40 years, they tracked 1,222 initially healthy middle-aged male executives. Every single participant carried at least one serious cardiovascular risk factor, like hypertension, a smoking habit, or high cholesterol. The researchers split the men into two groups. The control group received standard, everyday healthcare, but the intervention group received an aggressive clinical regimen. Doctors mandated aerobic activity, enforced strict diets, and heavily prescribed medications like beta blockers and diuretics. Looking at this chart, you can see the expected medical triumph at the 5-year mark. The intervention group's overall cardiovascular risk plummeted by 46%. But let's follow that same timeline further out. By the 15-year and 25-year follow-ups, a profound anomaly emerges. The mortality rate for the intensely treated men actually crossed over and climbed significantly higher than the men receiving standard care. The primary drivers behind these excess deaths were, surprisingly, unexpected cardiovascular events and fatal accidents. The medical community faced a paradox. They had executed a perfect multi-factor clinical intervention. They successfully improved blood pressure and cholesterol on paper, yet they had somehow ultimately shortened their patients' lives. Years later, Professor Timo Strandberg dug back into the data. He was looking for a hidden variable dividing the men who lived from the men who died prematurely. He found a massive divergence in the intervention group based entirely on time off. As this graphic illustrates, men who took 3 weeks of vacation or less each year had a 37% greater chance of dying than those who took more time. Those shorter vacations directly correlated with heavier workloads, chronic sleep deprivation, and relentless executive pressure. The men were surviving the boardroom only to face the added pressure of adhering to strict health regimens. That combined psychological strain physically overruled the benefits of the modern drugs keeping their metrics in check. To understand how rest actively repairs biology, we can look at modern research from Syracuse University, which measured the physical impact of time off. The researchers focused on metabolic syndrome, a dangerous cluster of conditions. These include high blood pressure, elevated blood sugar levels, and excess body fat, which significantly increases your risk for heart disease. This chart visualizes the mathematical power of stepping away. For an individual taking 0 vacations, the probability of developing metabolic syndrome sits at 47%. But every vacation taken in a year drops that risk by 25%. It steadily declines from 16% at 5 vacations down to a 1% probability for those maximizing time off. These frequent, intentional breaks provide a highly measurable mathematical defense against the complete breakdown of our metabolic health. We need to reclassify the vacation as a core requirement for preventative medicine, as essential to cardiovascular health as diet or exercise. The macro effects are staggering. Look at this calculation regarding mental health. The US average is currently 14.4 vacation days a year. If we increased that to the European standard of 24.4 days, the extra time off could prevent an estimated 568,000 cases of depression among women annually. Beyond the human element, that single shift in policy would save the healthcare system roughly $3 billion every single year. Systemically enforcing time away from work is just as vital to national public health as prescribing statins or checking blood pressure. You don't need a massive travel budget to start protecting yourself. Studies show the staycation delivers roughly 40% of the biological benefits of travel without ever leaving your home. But a staycation only works if you follow 4 strict scientific rules. You need total disengagement from your job, low alcohol consumption, prioritized sleep, and minimal external financial or childcare stress. The Helsinki study proved 40 years ago that relentless stress defeats the best medicine. Today, Syracuse researchers prove that frequent rest repairs our metabolic health, and staycations mean we can start that repair process immediately. Disconnecting from the work cycle provides a specific physical repair that no medication can replicate. Submit a PTO request tomorrow and protect your heart.